Welcome to the Deep Dive. Today we're heading to Nepal, looking into something really important, the growth of physiotherapy specialization.
That's right.
We've got sources covering, the history, where things stand now, and why this focused care is becoming so critical. Think non-communicable diseases, rising disability rates.
Injuries, too. It's a growing need.
Exactly. So our mission today is basically to unpack why specialized physio is crucial for Nepal and how far they've actually come.
It's quite a journey, really. It started very basically nurses getting some initial training.
Yeah.
Then you had Nepalists going abroad for degrees.
Right.
Formal education within Nepal came later. Certificate programs first.
Right.
But the big shift, you could say, was the Bachelor of Physiotherapy, the BPT program. Kathmandu University started it in 2010. Pokhara University followed.
And they're looking at master's programs now, too.
Yes, that's the next step planned, developing postgraduate options.
Okay, so these BPT grads, where are they working? Are they spread out across the country?
Well, you find them in various places, hospitals, definitely, rehab centers, community programs, even working with sports teams sometimes. But the data suggests they're more concentrated in private hospitals and clinics, and the main focus areas tend to be musculoskeletal issues and adult neurology.
Which brings up that question of access, doesn't it? If it's mainly private.
It does. Ensuring equitable access across the country is, well, it's a challenge.
And who oversees the profession? Is there a council or something?
Yes, the Nepal Health Professional Council, the NHPC, they handle the registration and licensing. You need to be registered with them to practice.
Got it.
And then there's NAPT, the Nepal Physiotherapy Association. That's the professional body. Their membership's grown, which is a positive sign for the field's development.
Okay, let's pivot to the why. What's really pushing this need for specialization? You mentioned diseases and injuries.
Absolutely. Nepal's seeing a real increase in non-communicable diseases, things like stroke, diabetes complications, plus more physical injuries and disabilities.
Was there a specific event that highlighted this?
The 2015 earthquake was a stark example. It led to many spinal cord injuries, needing very specific neurorehabilitation. General physio helps, of course, but specialized care can be much more targeted, more effective.
That makes total sense. For complex conditions, you need that deeper expertise.
Exactly. And globally, specialization is pretty standard in physiotherapy now. In Nepal, it's still getting established. We need more specialists in areas like cardiopulmonary physio or working with children pediatrics. The numbers are still quite limited.
So talking about building those numbers, what's the education journey like? How do you become a physio in Nepal?
Right, so the starting point is usually the Bachelor of Physiotherapy, the BPT. To get in, you generally need an intermediate of science background with biology or similar qualifications.
How long does that take?
It's a 4.5-year program plus a mandatory 6-month internship. Both Kathmandu and Pokhara universities offer this. This BPT produces general practitioners.
And then specializing. How does that work?
Well, Kathmandu University has taken the lead there. They have started a master's program, an MPT, with a specialization in musculoskeletal and sports physiotherapy.
What does that involve?
It really digs deeper, focuses on clinical research, advanced skills in that area, pain management, more specific techniques for sports injuries, for instance. And it includes a research project. Pokhara University is planning master's programs too.
Is it easy to get into these master's programs?
You typically need to pass an entrance exam run by the Medical Education Commission, the MEC, but a key issue is that there just aren't many postgraduate specialization options within Nepal yet.
So people have to go elsewhere.
Often, yes. Many who want to specialize end up going abroad for masters or PhDs. Building up that local postgraduate capacity is tough. You need specialized faculty, resources. It's a hurdle.
And that likely ties into recognition, right? How aware are people, like doctors or the public, about these specializations?
It's interesting. Doctors generally know about physiotherapy. Awareness is high there. But awareness of the specific educational programs like the MPT or even the professional body NAPT is surprisingly lower.
Really?
Yeah, especially maybe in government hospitals compared to private ones. It suggests maybe it's not covered enough in basic medical training.
And the public. Do they understand the difference between general and specialized physio?
Generally, no. Public understanding about the full scope of physiotherapy, let alone specialized care, is quite limited, and that impacts whether people seek out these services.
Even though they can access physios directly?
Yes, direct access is permitted, but the habit, the traditional model, is often see the doctor first.
Hmm.
And if the doctor isn't fully aware of what specialized physio can offer, or if the patient isn't, that referral might not happen, or it might be delayed.
So what are the biggest roadblocks then to getting specialization really established?
It's a few interconnected things. A major one is the lack of formal recognition, like official recognition by the medical boards, by the healthcare system, even by the public, that this person is a certified specialist.
And that impacts jobs.
Definitely. It leads to fewer specific job openings for specialists, limited career paths, and often, unfortunately, lower pay scales, especially if you want to work in more rural areas. Plus, there are infrastructure issues, equipment shortages, not enough dedicated rehab centers supported by the government, and the need for clear, standardized practice guidelines and ongoing training, CPD, for these specialized areas.
We saw mention of Binaya Kendall in our sources.
Huh?
He seems to be playing a key role.
Yes, he's an important figure. He has a master's in musculoskeletal and sports physio and holds significant positions now both in the Ministry of Health and at Beer Hospital, a major government hospital.
His appointment seems like a positive sign from the government.
It really is. His role as deputy chief physiotherapist was specifically to help initiate these specialty-based services within the government system. That's a big step. He's very focused on evidence-based practice, quality, accessibility, bringing in global standards.
So he's optimistic but aware of the hurdles.
Exactly. He sees the potential for higher education and specialization in Nepal, but he also knows the challenges, especially around getting that formal recognition established. He's involved in policy, training, trying to push things forward.
So looking ahead, what are the key steps needed? What's the path forward?
Well, first, expanding those postgraduate MPT programs is crucial. More specialties needed: neuro, cardiopulmonary, pediatrics, geriatrics, women's health. Maybe international collaborations could help with faculty and training.
And policy changes.
Essential. A proper framework for recognizing and accrediting specialties is needed from the NHPC and the ministry. We need specific practice guidelines. And, importantly, dedicated public sector jobs for specialists with appropriate pay. Specialized physio needs to be written into the national health policy more explicitly.
What about NEPTA, the association?
They have a huge role to play. Lobbying for recognition, organizing specialized workshops, building international links, and, crucially, raising public awareness about what physiotherapy, especially specialized physiotherapy, can do.
And research?
Yes, promoting research that's relevant to Nepal's health needs and getting those findings into actual practice through evidence-based guidelines. That's key for advancing care.
This has definitely been an insightful deep dive. There's a clear, growing need in Nepal. And while there are challenges, there are also dedicated people and initial steps being taken.
Absolutely. And it makes you think, doesn't it? As these specialized physiotherapy services become more available, more recognized across Nepal, what could that really unlock? What new possibilities for recovery, for independence, for overall well-being might open up for individuals and communities throughout the country?